leadership role on Manitoba's COVID-19 response team and her calm and reassuring presence for Manitobans and especially the healthcare system throughout this unprecedented time. Congratulations, Lynette. On behalf of all Manitobans, I also want to say thanks to you and all your colleagues in our hospitals, personal care homes, and in the community for the work that you do every single day to protect your fellow Manitobans. Your strength, dedication, compassion throughout this past year has been truly remarkable. Additionally, I would like to commend Manitoba's Vaccine Task Force for their incredible work to immunize all eligible personal care home residents throughout our province. That campaign, which was challenging and complex to say the least, is now complete. And now I can say that some of our most vulnerable citizens, more than 8,000 seniors in all, have the fullest protection possible against this deadly virus. While I give you that positive news, I will, as I sometimes do, remind you that there is lots of hope for vaccine advancements, but they're not here yet, and we do still rank 57th in the world. And so I remind Manitobans we are not out of the woods yet. And that's why today we are announcing that we're moving forward with some changes, what we'll call a two-phased approach to our public health restrictions. These changes, once again, are cautious changes to ensure we continue to protect and safeguard Manitoba lives. Aujourd'hui, nous annonçons que nous procédons des changements supplémentaires à nos restrictions. Ces changements sont encore une fois des changements prudents pour nous assurer de continuer à protéger des vies au Manitoba. I said 3 weeks ago, and 3 weeks prior to that as well, if Manitobans remain cautious and if we continue to follow the fundamentals that have enabled us to bend that COVID curve down and keep it down, that we would be able to share some more good news and get back to doing some of the things that we love and seeing some of the people we have missed. Thanks to the caution and hard work of Manitobans, we've earned more good news, and we'll have the opportunity, I sincerely hope, and I know we all do, to earn such good days and good news days in the future as well. For that good news, I will now pass it over to Dr. Brent Roussin. Thank you, Brent, for being here, and thank you for the good news.
Thank you, Mr. Premier, and good morning. Manitoba's case numbers and test positivity rates continue to trend in the right direction. That's why we're able to begin to look at other options to cautiously reopen services in Manitoba. Later this week, the following changes will be put into place for all health regions in Manitoba. These include changes to household and gathering sizes. Households can choose from one of the following options. They can continue to designate 2 visitors to their home. The restrictions that are currently in place, if that works for them, they can continue with that. Or households can designate a second household so that the 2 households can visit each other as long as everyone in those households has authorized those designated individuals to visit. Gathering limits at outdoor public or private place will increase to 10 people, including for outdoor non-organized sport or recreation activities. Capacity sizes at places of worship will increase to 25% capacity or 100 people, whichever is lower, with physical distancing measures and mask requirements. There's changes for businesses and restaurants. Any type of business will be able to operate with the exception of indoor theaters, indoor concert halls, casinos, and bingo halls. Capacity for retail stores, malls, personal services will increase to 50% capacity or 250 people, whichever is lower, with the other public health measures still in effect. Capacity for restaurants and licensed premises will increase to 50%, with the requirement for tables to sit only with household members, as well as other public health measures still in place. Businesses other than casinos can resume operating video lottery terminals with physical distancing measures or non-permeable barriers in place. Professional theater groups, dance companies, symphonies, and operas can resume rehearsals as long as they're not accessible to members of the public. We have some changes for recreation and fitness. Day camps for children can operate at 25% capacity with public health measures in place. Indoor recreation and sporting facilities such as gyms, fitness centers, rinks, courts, fields, ranges, studios, clubs, pools, and centers can open at 25% capacity with public health measures in place for any spectators, common areas, and locker rooms. The requirements for individual training or one-on-one instruction have been removed. Note that gyms, fitness centers, and pool users must continue to wear a mask while working out and in all areas of the facility, with the exception, of course, of somebody who is in a swimming pool. Dance, theater, music facilities can open for 25% capacity, and again, the requirements for individual instruction have been removed. Indoor recreation facilities such as arcades, go-kart tracks, children facilities can open up at 25% capacity with physical distancing measures in place. These orders will come into effect March 5th and will expire on March 25th. Later in March, we'll continue to evaluate whether we can stay at this level or continue to cautiously reopen. Looking ahead, we know that many Manitobans will be beginning to make their Easter and Passover plans. With these changes, people will be able to celebrate with another household. Well, I understand that this is not how we all wish to celebrate. It is more than what we were able to do at this time last year, and still necessary to continue to keep the transmission of this virus down. We shouldn't interpret these reopenings as a reduction in our risk. We were at this place before. We know that if we let our guards down, we're going to see transmission of this virus again, so we all have to be on guard, continue to practice those fundamentals. We still have a number of individuals in intensive care and in the hospital, and we know that as we see increased transmission, we start increasing the demands on that healthcare system. We know that there are variants of concern throughout Canada and been detected in Manitoba. We know that these variants spread more easily, which could quickly increase our case numbers and again put demands on our healthcare system. So with these variants of concerns, we know that the virus itself is still circulating Manitoba. We need to continue with our fundamentals. So we need that bit more mask wearing, more physical distancing, definitely more staying at home if we're ill, even if we're mildly ill. Very important, even mild symptoms can be COVID, so we need people with mild symptoms to stay home, get tested as soon as possible. But these are those fundamentals that we need to follow as we move forward. This is not a return to normal, but is a sign that as we continue to follow the fundamentals, as our case numbers continue to decline, we can ensure access to businesses, activities, and services that make our lives better. We need to continue to avoid those activities that are known to cause the greatest risk: crowded places, closed spaces, and close contact settings. This will keep the spread of COVID-19 down as we continue to immunize some of the most vulnerable Manitobans. We're getting closer, but we still have more work to do. So thanks again to all Manitobans. Thank you, Mr. Premier. I'll pass it back to you.
Thanks very much, Doctor. Our number one priority is in the face of this pandemic, and always, is protecting the health and well-being of vulnerable Manitobans. We're going to continue to focus on that, and in so doing, protect our healthcare system for others. I would mention as well, we have an important call with the premiers on Thursday on the issues around healthcare that we will be advancing, and I know that Canadians are more aware than ever before of the importance of the wonderful healthcare system and the wonderful people that we have working within it and managing it. We are also focused on creating an environment for a sustained reopening of our economy. It is, after all, that economy that pays for that healthcare system. And so we want our business community to safely reopen. And that's in part what today's announcement is about. But it's cautious as well in terms of the changes because we want to sustain this reopening. We don't want to yo-yo back and forth. We want our businesses to be able to be open and to stay open. We have been and we're going to continue to work side by side with all Manitoba businesses to help them do what they do best, create jobs for us, for our families, for our friends, our neighbors, and offer services and products to help us in our lives. But we also know that right now many of our businesses can't do that the way they would like to. And that is why I'm announcing today that we are offering the Manitoba Bridge into Spring grant, an extension of our previous bridge support program, which will be available to all Manitoba businesses, nonprofits, charities that have been forced to close their doors, or demand for their business has been negatively impacted as a consequence of the red public health restrictions. The bridge grant was first announced, a little bit of history here, it was first announced back in November 10th to provide $5,000 up front. In early December, we expanded the program to provide up to $5,000 in direct financial support as well to home-based businesses, not just brick-and-mortar businesses, but home-based businesses as well. And as the red orders, public health orders, were extended into the new year, we announced a second payment, bringing it up to a total of $10,000 in direct financial support. Today I'm announcing an additional $5,000. On January 12th, we extended the application deadline, expanded the eligibility criteria and protection to even more small businesses through the current public health orders, businesses such as hotels, resorts, lodges, outfitters, travel agencies, janitorial services companies, licensed owner-operator, passenger transportation businesses were all included as well. To date, this program has supported more than 14,000 Manitoba businesses, nonprofits, and charities. There's a total to date of over $135 million of support. But we know our small businesses are important to us, and we know the people who operate them and work in them are important to us too. And that's why these programs were designed to assist. This announcement today means an additional $5,000 for all eligible applicants to support them through this next phase of public health restrictions where they can't open as fully and operate as fully as most of them would like to do. The third payment for businesses and organizations who've already qualified or received support could be processed as early as March 5th, this Friday. So I guess the old adage is I'm from the government and we're here to help, and we're proving that we are here to help as best we can in these difficult times for our small business community. We're advancing this support now to help build that bridge through these restrictions, and we're all hopeful that those restrictions can be loosened even further in the future, but it all depends on us. For a full list of criteria and to apply, please visit manitoba.ca/COVID-19, click on Programs, and then click on Manitoba Bridge Grant. Again, manitoba.ca/COVID-19, click on Programs, and then click on Manitoba Bridge Grant. Our government remains committed to delivering the right programs at the right time to help individual Manitobans and businesses through these challenging times. We continue to offer, and today we've expanded upon what were already the most generous supports in this country. Our programs are broad-based, they are easily accessible, and they provide direct financial support where and when it's needed. It's important to understand that the heavy lifting we did as a government to get out of the billion-dollar deficit situation we inherited and move to balance set the stage for us to be able to offer programs such as these, programs that can help through these times of need. Getting ready was hard work, but we did that work as a government, and Manitobans supported us in doing it, and now it's going to pay off in helping our business community and us as individuals weather the storm that COVID has provided us with. At every step of the way, we've endeavored to reach out directly to Manitobans to ask for your views, to get your input, to get your feedback, and determine what your priorities are on a variety of measures, not just during COVID, but before. But I wanted to say a special thank you to Manitobans for their input over the weekend. This is helpful to Dr. Roussin, to his officials, to our government, as we make decisions. And approximately 25,000 Manitobans participated and gave us input since February 25th on a variety of the measures that were talked about and proposed last week. Understandably, some of you said you're going too fast, and some of you said you're not going fast enough. And to all Manitobans, you know, I know we can't please all of you. That'd be the surest way to fail, my dad used to say. But the fact of the matter is we are going to continue to proceed, and we are going to continue to proceed with caution, because it's sustaining this progress that we're all after. While Manitoba COVID cases continue to trend in the right direction, thanks to the choices Manitobans are making, I have to remind Manitobans again that we're not out of the woods yet, and we have to stay on guard. Winter's still here. It doesn't seem like it today. It's a nice change in the weather, but the variants of concern are still a concern to us, as they are across the country and around the world. And the vaccines, in large part, are not here yet. Only 2.8% of Manitobans aged 18 and over have been fully vaccinated. So there's lots more work to do. The level of caution remains and must remain high. Remember, when you get together inside, you're giving COVID a chance to have a comeback. Stick to the fundamentals, limit your risks, avoid the 3 C's, close contact settings, crowded spaces and crowded places and closed spaces. Say that fast 3 times. So remember also to do the fundamentals. Wash your hands. Stay home when you or any member of your family is sick. Wear a mask, limit your close contacts, and stay positive. You know, hope is in the air, so embrace it. Spring is coming. The vaccines are going to be here. There's lots of reasons for optimism. Just remember to keep playing defense. Happy to take your questions. Brent and I would be happy to entertain any questions you may have.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have 1 preliminary and 1 follow-up question. Up first this morning from the Winnipeg Sun, Glenn.
Glenn Dawkins from the Winnipeg Sun. First, Mr. Premier, first thing for whichever one of you wants to deal with this, you've opened the household, or to having additional household, or 1 additional household over 2 year. Was there consideration of, with the expansion and the limits on restaurants, to doing a similar thing with the restaurants, as in allowing more than just a single household to be able to be in a restaurant?
You know, we certainly look at a number of issues similar to that. We know that the restaurant, just sitting at a table, prolonged indoor periods of time is an increased risk. We knew that if we open up to include your designated household or designated members, then all possible ways of ensuring that that's enforced is gone. There would be no way for restaurants to know whether somebody was actually in another designated household. There would be no way that we'd could avoid multiple households at the same table. So at this point right now, it's not the risk that we're want to take. We know that that's challenging. We know it's challenging on restaurants. We know that Manitobans want to get out with other people at these restaurants. We just can't have people from different households, multiple households, sitting at the same table for prolonged periods of time indoors right now. So for now, we're keeping that limit.
Question for the Premier. The Bridge Grant Program, we've heard from business owners that there were problems with the program. I spoke with a business owner on the weekend who received 2 of the $5,000 checks, only to be have it turned around, and she had received it from the wrong part of the program, and she was requested that she send the money back. Are you confident that I don't want to call them bugs, but that any problems with the program have been worked out?
Well, first of all, I'm confident that we've done our best to get the money out the door to businesses who need it. But with any program, there are going to be potential confusing aspects to it. That's for sure. So I'd be encouraging the business owner to make sure that they've made an inquiry to determine the rationale for the change. I think that'd be a smart thing to do. You know, we have a really, really diverse small business community, Glenn, as you well know. So, you know, the program, you can't have a program that hits every single business, I don't think. We're trying to get the money to those that are hurt by COVID the most, and that's what we've been doing over 11,700 times. So, you know, I just encourage that person to follow up and get answers to the questions about eligibility.
From CBC Radio Canada, Matthew.
Hi, my first question is for the Premier. How do you plan to deploy the AstraZeneca vaccine?
My first answer will be Brent's answer.
Yeah, so the AstraZeneca vaccine, it's a welcome addition to the vaccine repertoire that we have. You know, our goals is to protect as many Manitobans as quickly as possible, and right now the rate limiting step there is just access to vaccine doses. And so for the specifics, I'll let the vaccine task force discuss that, but it's a welcome addition for sure.
How do you plan to check if the household will respect either the two designated person or the mutually designated household?
We'll continue with the enforcement team that has been working hard to make sure that we're sending the message out loud and clear that these are health orders that need to be followed, and that enforcement will be a part, along with, of course, the ongoing education and information that we have really focused on getting out to people to ensure that all of us are doing our part to keep each other safe.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. Here's an old one, but a good one, or maybe not a great one. When are we going to see some forward-looking projections now? Clearly, you've stated we're in our second lowest of the four potential scenarios in the recent past. That gives you confidence to go ahead. There are a lot of factors here, but when can we see where we may be going now that we have at least a modest vaccination timeline and low indicators?
Yeah, and so that's the modeling right now is being done to work in the effects of the vaccine. I don't have a final product on that. You mentioned what we're currently tracking on is the second from best scenario, or those four scenarios that we've shown. And so if we continue along that trend, we're going to see continued declines in case numbers. Again, there's that significant lag in, say, ICU numbers that we see with this. And if we start having less adherence to these public health restrictions, then we're going to start bumping up levels. So it's difficult to predict what the effects of these orders will have, because it all depends on the actions of Manitobans. But moving forward, if we continue on our trend, we see continued numbers going down. If we have the variant of concern take a foothold, then of course it shifts all of those trends to the left, and we'll see a growing number of cases. And then of course we're waiting now to see some modeling on vaccine and anticipated vaccine uptake and delivery, and we'll provide that when we can.
Thank you for that. The next one's for Mr. Premier. Mr. Premier, I'm assuming that this next tranche of bridge grants will use up tens of millions of dollars more than the $200 million allocated. If there's any money left in that $200 million, what sort of sector-specific support would the province contemplate?
Well, the hardest hit, we're going to be, we anticipate over $215 million of total payments under the bridge grant loan. That leaves out the earlier programs. Bartley, you're familiar with, of course. You know, the initial GAP program was, I think, approximately $50 million as well. We also had programs to encourage reemployment of people in the spring for summer students especially that were very successful. The uptake was good. We had a wage support program. We had a program to help people get off CERB that helped literally hundreds of Manitobans get back to work. And so adding these all up is why I assert that we have, per capita, we have the greatest investment in Canada in supporting our industries and our individual small businesses. But I wouldn't take anything off the table. We have another $50 million that we're looking to allocate. We've allocated some already to the restaurant industry for some specific support programs. We're looking at the hotel industry as well for some additional supports. And beyond that, we're always cognizant of the need to help people bridge through this program, as the program is named.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. I just want to double check. We're just going through the written material that's been handed to us. Are fitness classes allowed to resume at 25%?
That's correct, yes. So we removed the requirement for individual fitness or one-on-one instruction from that whole group of, indoor recreation. So it's now the 25% capacity, the mask rules, the physical distancing rules, but there's no longer a requirement for one-on-one instruction or individual fitness.
Okay, and can you tell me if there are any differences between what was proposed last week and what is being enacted March 5th? And if not, what the second phase of this two-phase reopening might look like?
So yeah, the only substantial difference was the mask rules regarding the indoor recreation. We had contemplated possibly while people were exercising to not require the mask, but we decided to keep that in at this point. We originally floated these proposals to Manitobans to potentially take place over two phases. As we look at our numbers and the trends going down, we felt that they would safely fit into this round of orders. And then in that, in the next number of weeks, we'll again reassess things to see if there's anything else that's in order.
Steve, there's also some considerations we have to be real about. We all know that we really didn't have a first wave and that we were hit really hard in October and November of last year, and we know that started around the time of Thanksgiving. We have to remember Easter's coming and spring break, Passover. These are traditionally times when we like to get together. We're going to have to remember the lessons of last fall as we move forward into the next few weeks. I think that's really critical, and I think it's important that all of us remind each other that although it's great to get outside and run, like I know some of us like to do, it's a lot better and healthier for us to do that as opposed to getting together in groups inside. So that reminder is just an admonition to keep on the horizon that we're going to be playing defense for a while yet.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. I'm wondering why or if you're looking at the interprovincial travel restrictions with the isolation upon arriving in Manitoba. I know it's not in this one, but would that be something that you would consider for the next round?
Well, we look at review all these orders over time. Right now, our concern is the variant of concern, and we know that there's a community transmission of this in other jurisdictions in Canada. So, and we know that if that took a foothold in Manitoba, it sets our plans back. So we want to be cautious with that. I do note that our variants of concern that we have detected in Manitoba so far are coming from international travel. We're not seeing a lot of cases related to domestic travel, so we are looking at that. But we have to be cautious with the upcoming, travel seasons of spring break. This was a significant factor in the first wave for many jurisdictions where they saw a lot of travel during spring break. So we're going to still be cautious with this, but we definitely are reviewing it.
Thank you for that. And then, sorry. Is there anything that could potentially come forward if we do get community transmission? You said yesterday community transmission was fairly low in the province. You say you don't want to yo-yo, but how probable is that if we could do that, go back?
Well, certainly the risk is there. The fundamentals are there for a reason. The public health restrictions are there for a reason. If we go back to interacting like we were in October and November and December, we're going to see those numbers again. We're in a bit of a race now for the nicer weather, for receiving more and more doses of vaccine. But right now, we're still at a risky spot that if we let our guards down, we can get back to that widespread community transmission, and we'll have to consider what to do at that point if we were seeing a lot of strain on our healthcare system.
From CityNews, Mike.
Good morning, Mike on CityNews. It's the 1-year anniversary of the first case in Manitoba. We just hit over 1,000 tickets sold out and over $1 million in tickets. Is this, I don't know if there was a projection for this, but is this where we expected to be at this point? Is this too much? Does the province need to do more with their messaging?
I missed the first part of your question, Mike, and I hope I'm going to answer what you asked. I think you asked about enforcement, and we're referring to the number of fines levied. The fines levied have gone down this week. They went down a little bit last week. The trend is down a bit. And I like to take that as a message that Manitobans are doing the right thing and listening to Dr. Roussin and I and others about following the health orders. We continue to bolster our messaging on the education side because we prefer to prevent violation of health orders rather than find someone who's doing it, because of course when they're doing it, they're exposing other people and themselves to risk. And so we're going to continue on that two-pronged strategy going forward. I think we should remember these good news announcements of the last few weeks were earned by Manitobans by doing the right thing. Earlier question asked what happens if we don't do them anymore, if we don't follow the health orders. What will happen is we'll all get punished. Frankly, it's a pretty simple example of do the right thing and then we can all get through this thing together. And that's what we've been saying from the get-go.
Thanks for that. For my follow-up, are businesses that are struck with $5,000 fines for breaking rules and restrictions, are they void for applying for the bridge grant at all, or does that not come into effect?
No, they'll end up being dead even.
From CHVN, Taylor.
Hi, good morning. Earlier there was concern about the spread of COVID when it comes to droplets for things like singing or playing instruments. For parents, can you explain the potential risk and how music lessons or band class could work?
Yeah, and so the predominant method of transmission of this virus is through droplet spread. So these are larger droplets that tend to go to the floor quickly. This is where we get that 2-meter separation from. But it's not black and white. There's a continuum. There is some aerosol generation, and there's some studies showing that in certain circumstances we can have aerosolization of this virus where it's suspended more in the air and could be transmitted a bit wider than that, say 2 meters that we all rely on. And so we have medical procedures that generate aerosols, and so we have precautions when those take place. And then there's other circumstances where there is singing or wind instruments that is thought to potentially increase that risk. So I think we have to balance the benefit of getting back to these things with protecting against widespread transmission. So again, capacity limits, distancing, looking at specific practices can sometimes reduce that risk. But overall, we do see transmission in those circumstances, so we have to be really cautious moving forward.
And when can people expect to have a somewhat normal worship space community again? So with bringing things back like singing during the service or having non-regular religious classes?
You know, it's going to depend on a lot of things. There are a lot of variables there. It's going to depend on our vaccine uptake. If as we get more and more vaccine, if we get a high proportion of Manitobans taking us up on that vaccine, we'll be able to get back to a lot of things we want to do. We'll just have to see how the fundamentals are followed, what the transmission is like. So I can't answer specifically to that. There's a lot of variables, how well we follow now, and also the overall vaccine uptake. But you know, time will tell us where we'll get back to those type of things.
Thank you.
From the Winnipeg Free Press, Danielle.
Hi, good morning. My question is both for the Premier and Dr. Roussin. With the restrictions again being lifted and our COVID cases at low levels, what would be your preferred course of action if we see a large outbreak or pockets of increased community transmission? Would you be in favor of issuing short lockdowns in affected regions to contain the spread, or would you be prepared to deploy mass rapid testing in some communities? I guess what public health interventions would you want to see?
Yeah, so we have a number of approaches to this, and so definitely when you have lower numbers, we can do very thorough contact tracing, have cases and contacts isolated. We're watching transmission quite closely. So there's a number of options, and it depends. If we start seeing many clusters linked to certain sectors, then we might have to dial back things on specific sectors. And so, we want to be able to, again, get back to a very targeted approach rather than the widespread restrictions that we required when we had widespread community transmission. We would much like to get to a position where we could target interventions. That could include testing. It could include sector-specific restrictions if necessary.
Okay, thank you. And my second question is for the Premier. Representatives from all three political parties in Manitoba have written an open letter to you and to the opposition leaders expressing concern about using the rules of the legislature to score political points in a way that undermines democracy. So what is your response to this letter, and will you and your government take it to heart?
Well, we've always said we'd be ready to sit down with the opposition parties and make the rules work better for people, and we'll continue to take that position. They haven't taken us up on the offer. I can only tell you that some of the factual errors in the assertions have to be addressed, and I will do that now. First of all, the NDP opposition blockaded the legislature during a global pandemic last spring, and so the argument that we're introducing too many bills is answered by that, I guess. Frankly, the work of government goes on, and in fact the NDP did introduce more bills historically than we're introducing this year in the past, including in the year that they brought in the PST hike after promising they would not. So on the second issue, in terms of availability of the bills, which is a concern for transparency, on December 3rd of last year, our government asked for unanimous consent so that we could distribute the bills over the winter so that everyone could have a read, including all Manitobans. And that was refused by the opposition as well. So we're doing our best to catch up as a result of the NDP blockade of last year, to be transparent in terms of getting the text of the bills out to people. And I would say, I'm calling back the legislature to begin tomorrow, which is 5 weeks earlier than the NDP, when they were in government, called the legislature back, because we are a hardworking government and we are going to have more time to deal with these bills. That, after all, is what elected members of our legislature are paid to do. And so we're coming back earlier. We've tried to get the bills out earlier. We tried to introduce them earlier, and we've been rebuffed all the way. We're ready to play nice, but we're also the elected government of Manitoba, so I would encourage the opposition not to try to pretend that they are the government of Manitoba. They are not.
From Global News, Joe.
Hi there.
Dr. Roussin. There are some people out there wondering when in-person meetings can resume, such as board of directors type meetings or annual conferences, those type of things.
So it's, again, the timing of these things are going to depend on a number of variables. It's going to depend on the dynamics of transmission that we're seeing. It's going to depend on vaccine uptake. So it's hard to speculate now on when something will be returning. We're going to take that cautious approach and try to move forward, continually moving forward, but cautiously. And for the time being, prolonged indoor contact should be reduced as much as feasible. And so, as time goes by, we'll be able to update Manitobans on what the proposed loosenings are, but it's hard to predict when that will occur.
And do other businesses and indoor rec fall into the same category as restaurants, like that household only rule?
So what's going to be required there is that physical distancing is going to be required within the 25% capacity, but of course members of the same household would not have to distance from each other.
From the Brandon Sun, Colin.
Morning. Mr. Premier, last week the president of the Brandon Chamber of Commerce was very critical of your government's handling of the pandemic, saying that slow approach to reopening has been disrespectful given how well Westman has done for cases. He said that the one-size-fits-all approach to the Manitoba Bridge Grant wasn't suitable for some businesses who are facing more losses than $5,000 per payment will handle. And he also said that you have ignored the needs of Westman in recent years. I was wondering how you felt you've done managing the pandemic with respect to Western Manitoba.
Well, I can only say that as a former Chamber of Commerce president, I would sympathize with the frustration of small business people and recognize that a chamber president might want to express frustration about the nature of a pandemic and its effects on businesses. But I would also like the chamber president to acknowledge, in fairness, that we have created a greater climate for the profitability of small businesses prior to this pandemic than existed before, that we have led the country in reducing unnecessary red tape, that we've enhanced the supports for our business community, that we've reduced taxes for our small business community, including the tax on services and on businesses themselves. We've also advanced a variety of agenda items to help our small business community prosper, and we have been leading the country in most categories of attracting new investment to our communities, which of course is good for the businesses that are here as well. So in fairness, I would ask for that balanced perspective, and I understand the frustrations very well as a former small business person myself. I understand that we want to get reopened, but I also understand, and I know the Chamber President does as well, that we want to save lives. And Dr. Roussin's estimates have us saving well into the thousands of lives because of these things. So it's in no one's best interest to lose customers with a rapid reopening. It's in everyone's best interest to protect one another with a measured, cautious approach to recovery, and that's exactly the approach we'll continue to take.
Is your government considering any supports for businesses for which $5,000 won't make the difference between them staying open and closing?
You could say that we are supporting small businesses better than any other province, and you'd be right. You could say that we've made the right programs available at the right time, and you'd also be right. You could say that we're not giving every business back the profits that they wouldn't get because of COVID, and you'd also be right in that. COVID has caused losses to our companies throughout the province and to the people of the province that we'll never make back, into the millions, hundreds of millions of dollars. And no government treasury, including the federal treasury, can make everything whole again. That being said, we're doing our best to bridge through these difficult times and come through in a way that allows us to spring forward in terms of our recovery, as we are predicted to do by some of the leading financial evaluators of economic recovery. The analysis shows that Manitoba will be among the leaders of all Canadian provinces in terms of recovery. Part of the reason for that is the supports we put in place, and we were able to do that because of the work we did in the first 4 years of our government to make sure that we stabilized our province's finances. There was a time when we had billion-dollar annual deficits. There was a time when our credit rating was going down. Those times are gone. And so, yes, we'll have a higher deficit this year because of COVID, but without COVID, we would have been in surplus as a province and able to do more to support our most vulnerable citizens in healthcare and education and in social services. We lead the country in investing in healthcare, education, and social services on a per capita basis under this government, and we also move to balance our budget. That's a pretty good accomplishment that has put us in a good position to come into COVID better than most and be able to offer the supports we're offering. Never enough, always frustrated with COVID, no doubt about it, all of us are. But if we stick together, we'll come out of this, and we'll come out of it together more prosperous in Manitoba as a result.
Our final reporter this morning, Mr. Premier, from CBC National News, Cameron.
Hi, Cam McIntosh with CBC National. Dr. Roussin, just I'm hoping you can clarify something, and I apologize, I haven't seen the actual lettering of the actual rules just going off the press release here. When talking about outdoor gatherings going up to 10, it mentions for non-organized sport and recreation activities. I'm wondering on the indoor side with gyms, fitness centers, rinks, courts opening up, does this potentially allow the return of organized team sports? For example, can a spring hockey league get going if they're playing in an otherwise empty rink?
Yeah, so the intent right now is going to be to try to get teams back to practices, to drills. As far as games with multiple teams, we're not quite there yet, but that's where we're heading. And so this does get, hopefully that process moving forward to get, especially the youngsters back on with teams, drills, and practices. As far as organized teams activities and league play, that's something we're going to continue to look at.
Okay, and just on, I guess, kind of the semantics of how we're labeling everything here, does Manitoba stay at critical red with these restrictions being lifted or relaxed, or why don't we move to orange now?
So right now we're still at a critical point in our pandemic response. So we've seen certainly numbers trending in the right direction. We still have some demands on our healthcare system. We are being faced with some risk with the variants of concern. So right at this iteration, we're going to continue to have the entire province at red. As we move forward, we'll continue to look at our pandemic response system and whether we want to approach a regional approach again, or whether we'd be in a position soon to change that level. But as of right now, we're remaining at critical.
I want to conclude by thanking Dr. Roussin again. Again, congratulations, Lynette Siragusa, for that well-deserved acknowledgement. I wanted to also acknowledge and encourage the Mayor of Winnipeg in moving forward on an anti-racism initiative. This is something that we have been working on very hard at the provincial level. We introduced an anti-racism strategy in tandem with our workplace safety initiatives to combat harassment and bullying in 2018, and we're continuing to enrich those strategies that we've introduced within our provincial civil service, but it's nice to see a mayor taking leadership on this important issue. Thanks, everyone.